This is deception. And I don't understand why this is necessary or why you would post it. Hey everyone, this is Dr. Tom here in Peachtree Plastic Surgery in Atlanta, Georgia. And today I'm going to talk to you about this fun, exciting topic. We are going to talk to you about how Instagram fools you. And particularly, not really Instagram, but how before and after photos you see on Instagram, how they're made and how some of them are very deceptive in how they present the results. I'm going to show you the different ways they do it. And in particular, there is 5 different ways that people deceive you with photographs on Instagram. Let me tell you a little bit about before and afters in medical photography. So in plastic surgery, photography is everything. It's how we show you how our results are. It's one of the most important things you look at or patients look at when they're looking for a plastic surgeon. Let me see before and afters. I see it all the time on the plastic surgery subreddit on Reddit. Please check me out. My name is Dr. Tom PS. You can find me there all the time. Great group of people. If you have plastic surgery questions, they have answers. One of the most frequently asked questions is, how do I find a plastic surgeon? How do I know this person is going to be the best? There's a whole other topic about what the best actually means and why there is no actual best in plastic surgery. But for today, one of the things they always come up with is they look at credentials, always the most important. Second thing is reviews, which I don't really like reviews as much, but it's something to look at. And the third thing is before and after photos. It's a big part of how people find a plastic surgeon. And it's the most prominent thing on all of our websites. It's the most looked at thing on every plastic surgeon's website. It's all over Instagram. It's all over RealSelf. They are critically important to us. The orthopedic surgeons, we would work with them all the time, helping them reconstruct the soft tissue over bones. And they would take x-rays of everything. They didn't care about photographs at all. They cared about x-rays. Well, for a plastic surgeon, a photograph is our x-ray. It's how we know we've done something, how we can track progress. We are very superficial surgeons in that way, where we really use photographs to document as medical documentation and to show what we're capable of to the world, to our future patients, and to each other. The American Society for Plastic Surgery, our society, publishes photographic standards for plastic surgeons and how to take photos of specific parts of everyone's body. So there's face photos that are supposed to be taken head on with a certain amount of the face. There are photos for the body that are supposed to be taken a certain way. And photos should generally be of the same lighting, the same quality, the same distance. We will try to make the before and after as close to the same as we can. And that's what we're trying to do for our documentation, but also to show to people. However, now with social media, the internet, and how important it's become, the before and after photos, people, not usually plastic surgeons, but other cosmetic providers, will maybe modify or enhance the results a little bit. Not necessarily Photoshop, but there's ways to do it. And I'm going to show you exactly how people do this. This photo trickery of how to take photos to make your results look better than they actually are. And I'm going to show you just a bunch of photos. We're going to go through exactly how it was done. I'll go through some examples I found on Instagram. They're just great. And then I'll show you how some people that do it right and do it well. And let's start looking at some photos. The big one I found is lighting. I took, and I'm going to demonstrate to you and show you exactly how people do this. I had our wonderful nurse practitioner, Rachel, take 2 photographs of another one of our staff members, Joanna. And they're taken pretty much identical. And here's a video. You can watch and see exactly how we do this. She takes one photograph straight on with the flash straight ahead. And it flashes right on her face. The second photograph she takes with the flash up, so the light bounces off the ceiling. And these are the results you get. So here's a side-by-side, a typical full face before and after you might see. And you can see when you shine the light directly at someone's face, it removes all the shadow from their face. And if you have a full face photograph like this is a standard full face frontal view photograph. If you shine the light, her skin looks more radiant. There's no, you don't look under her eyes, and her nasolabial folds don't look as old. She has all of her fine wrinkles are gone, almost all of them. It's a better looking photograph, but it's really deceptive. But this you could probably tell if you saw her full face back to back. But let me show you what it looks like when we just say, did a treatment around her eyes. So this is her photograph if we just zoom in on her eyes and do a little bit more editing to get the brightness about the same. And again, I haven't airbrushed anything, I haven't retouched anything, I haven't changed the colors of the photograph at all. All I did is I took the two photographs just as they were taken. I opened a $15 program that's super easy to use. It's called Photoshop Elements on this Mac laptop that's 6 years old. And this is what we came up with to do this. And all we did is zoomed in on her eyes and brightened the photograph a little bit. And this is the result. Now I could tell you that I did a radiofrequency skin tightening treatment around her eyes or even an upper blepharoplasty, and this is actually a pretty good result. Except none of that happened. All these photos were taken 5 seconds apart. So how do you spot this? Well, the giveaway here is if you look in her glabella, which is right here, the center area, it's very bright and shiny. You can see the light shining off of it. And also look in her eyes. In the bottom portion of this photograph, you can see the light reflecting from her eyes. And in the top one, you can kind of see the light shining upward. It's more dull. That's how you can tell where the light has been shined. If she has shadows coming down, then the light has been bounced off the roof, which is a better photograph. And a more clinically meaningful one, you want a little shadow on the face, a tiny bit, just so you can show the wrinkles. Otherwise, you just shine light on the face directly at it, and that's what you get. And a couple more examples of this you've seen before and afters. Here's my big head with a little line in the middle of the exact same photo trickery. It looks like I had a lower blepharoplasty or maybe some facial filler or a skin treatment of some kind. Nope, just the light shining in my face, and then you put a line right between the two photos. Again, took me 2 minutes to make this photograph, and let's say I did get a radiofrequency treatment and I put this up. You'd never know what's the photograph and what's the actual result. We also did our biller, Jen. She's a beautiful woman, and we did exactly the same thing. Just another way to show you what a difference lighting makes. And it's not even studio lighting. It's not the lighting that I have right now. I have two big lights on the side right now. It's not that. It's just a flash on top of a camera. It's literally this camera with this flash pointed up or pointed forward. No other changes. And that's the dramatic difference you can get in the quality of photos. This camera is not expensive. This is a Nikon D5300. It's half a dozen years old. And yeah, it doesn't shoot 4K. It has an old sensor. The speed light costs $100. You know, this is not fancy photography equipment. And these are the results that you can get. So let's take a look at some things I found on Instagram, and then let's see if we can pick out, and I'll show you why they're bad examples or why they're photo trickery. All right. So this first example, InMode. I love InMode. So InMode is a device manufacturer. They make all kinds of devices, non-surgical devices of different kinds. They some skin tightening, some lasers, this kind. And they actually do work to some degree. So I don't actually know why their Instagram is so intent on publishing photo trickery as their before and afters, because the devices actually do show a result. But of course, it's better when you do this trickery. So this post from them, you can see the difference in lighting. So if you look at the photo on the left is lit from the left some way. It's also a little blurry and out of focus. If you look at her expression on her face, it's like a meh kind of expression. Doesn't look that great. And then if you look at the photo on the right, it's softer, it's sharper, she's smiling. And you know, it's funny because if you look at her actual chin and neck, which is what she came in and got treated, there is actually a result. But it's really hard to tell with the way the photos are so different what the result is and what's photography. As I just showed you, the doing this can change the photo so much. Anyway, I don't know why they need to do this. The results would speak for themselves. All right, let's look at the next one. Oh, this one. Okay, so the first thing we talked about was lighting, how lighting can affect it. And we went all through lighting. The second thing is timing. So this is another InMode post. I got a lot of InMode posts. They're just great. So this lady got treatment, IPL, and a IPL is not a laser, but an intense pulse light device that helps take pigment out, and a Morpheus 8 radio frequency microneedling, so something for skin texture that heats and injures the dermis and causes new collagen to be laid down. Effective devices. And she got these stretch marks, and she wanted, if you read their post, it says, we started treating them ASAP because they respond best when they're new. So this tells me that this patient has new stretch marks, and they're red. Most striae or stretch marks are red when they're new, and then they become skin colored over time. And InMode is right here. You should treat stretch marks and scars when they're newer and they're still healing. That's when you can modify them the most. But they will heal on their own and change color on their own over time. So these photos were taken 1 month post-treatment. Well, it would have changed color anyway, regardless of whether you did anything 1 month apart. So this is kind of trickery. It's also kind of not, because you never really know what they would have looked like. Maybe they would have been brighter. But how much of this result is just normal healing? And then also the photos are taken at different angles, they're taken in different locations with different lighting, and this is probably a patient that sent in her own photos, but still, it's not a good representation of what the device can do, but rather what time and different angles can do. All right, the third thing that they trick you is zoom, or different aspect ratios. And again, InMode is shining through here. Here's a patient who got the future of body contouring, evolved body contouring. The most effective way to tighten skin, melt unwanted fat, and increase muscle mass. It's freaking amazing. I love when people make all these claims. It's just so funny to me. It's the most revolutionary thing ever. It's not, but whatever. Tighten, trim, and tone. And I'm sure it does all these things to a certain degree. But then they show this photo. And what does this photo show? This photo shows somebody who is completely different size. Like, it's zoomed in on the one on the left, and then it's zoomed out on the one on the right. The photos are taken from different distances, possibly with different lenses. At least they're taken with the similar lighting in the same room, but it's that zoom. It makes her look smaller. And there's some effect here from their evolve. I have no doubt that they use the device, and I have no doubt that some of these results are from the device, but it's really hard to tell when the photo is of a different zoom or a different aspect ratio. All right, the fourth one is filters. These are pretty obvious. I think most people can spot these. This is from Beneath the Treatment. It's a Power Acne Cleanse facial treatment. Yeah, so you can see this. Like, everybody can see that this is a filter. I don't know why you'd post this and then put a filter on, because her acne probably is better after this treatment. I imagine it's a peroxide-based acid wash, or some other standard acne treatment that they bottled up and put into a facial cleanse, and it works for acne. Not disputing that at all. I'm just saying you don't necessarily need to post an after photo with a filter on. We can all see that that's a filter. So that's not that tricky. Here is a Twisted Beauty Boss from Hackettstown, New Jersey. So this is somebody, she says, happy April. Now that it's spring, we're getting rid of the dull winter dry skin that's imperative to look glowing. And why wouldn't you want to look at this before and after microdermabrasion, double exfoliation. That's 2 exfoliations. Better than 1. Facial. I don't know how you evaluate what happened here. The photo is taken with a lens straight on. This is exactly what I showed you. Lens straight forward, light flash straight forward. There's nothing different about this photo. His skin, I can't tell a difference. If she actually did a double exfoliation, I'm sure there's a big difference, but it's hard to tell when there's a light shining directly at his face. His skin looks good. I'm assuming it's because of the microdermabrasion double exfoliation facial. I don't know. All right. Here's another example of lighting. Now, this is a classic example, but the reason I bring this up, this is from Beliza Hudochspa. Beliza Hudochspa is from a different country, and I am not even going to attempt to say that. But what they did here is exactly what I showed you on the eye. They had direct lighting versus indirect lighting. So on your left, you have indirect lighting. Her skin appears a little paler. She has some cooler lighting. And on the right is more direct lighting, and it faces the shadow. When you have light shining right into the shadow, it makes it look less deep. But the interesting about this one, look at her eyes. On the left, you can see there's a straight line, a straight bar of light. And on the right, they have a ring light. Ring lights are great for the face. They illuminate the face really well. All of your favorite streamers and YouTubers, they all use ring lights. Someone going on Zoom meetings all the time will have a little ring light in front of them. It's a great way to illuminate the face. The oral surgeons love it. It illuminates inside the mouth. But it's interesting, you can see it here. I just don't know why they wouldn't use it on the first one, or maybe they were using it but covered half of it. I'm not sure. But this is just another example of what lighting can do. All right, here is the most egregious photo trickery I've seen on Instagram. This is, again, in mode. You have won the prize for photo trickery here. On the left, we have this beautiful woman who is starting in January of 2020, and we have a 3-month progression of 6 photos of how InMode changed her life by using Morpheus 8 treatments. So let me just preface this by saying Morpheus 8 does work. I don't know why you need this trickery, but look at the January 2020 photo. You can see every little pigment on her face. They turned the contrast so far up that she looks awful. Every wrinkle, everything, and it's sharp and highly contrasted, and it looks terrible. And then they turn the contrast down, and so she immediately has a result after the first treatment. And then the subsequent photos go on, and she gets a little brighter. They turn the brightness up a little bit. They turn the brightness up a little bit, until finally the very last photo, all of a sudden, there's a light going directly at her face to show the final result. Why? Your treatment works. You don't need to do this. This is deception. And I don't understand why this is necessary or why you would post this. And in our society, if a plastic surgeon were to do this, it violates the code of ethics. So this is something that we wouldn't do, and we shouldn't do. I'm sure it has been done by plastic surgeons, but we shouldn't do it. All right, before we go, I wanted to show you a couple good ones. So there are some good examples out here. This is from Carruthers Cosmetic. I'm not sure where this is, but their photo is on point, and I'll tell you why. This is Botox. They're talking about the zoom boom. This is a standard photograph of a frontal face. It's exactly where it should be. It highlights his whole head. It's taken exactly the same, with the same distance in the same room, with the same background, the same lens, same camera, and same facial expressions that he's trying to make. The only difference here is he shaved his beard, and that's nothing you can do. This is an excellent photograph, and this, you can tell, all of the result is due to the treatment. And this gives you a great idea of what these people are capable of doing with Botox, which is so useful to you as a potential patient or anybody watching this. Look in his eyes. The light reflex from the camera is exactly the same in both photos. It's amazing. It's perfect. All right, this is coming, another example of a great one. This is from Dr. Jazz in Orange County, California. He is an awesome plastic surgeon. He did this notched earlobe repair, which is deceptively difficult to do. And he took this photo. Now, this is probably not taken in a photo room. This is probably just taken with a regular camera, but he did it right. Look at the light reflex on the ear. It looks identical, both before and after. So you can see the real results of his surgical treatment. The zoom is exactly the same. The angles are the same. It's really good. This is great photography, and this really gets to show you what you can do and how well he can fix a notch repair. And he did a great job. All right, the last one. This is the gold standard in my mind of facial photography. Dr. Ben Taleli in Beverly Hills, amazing surgeon, but his photography is absolutely perfect. It is as good as it gets. It is textbook. Same camera, studio lighting, in a photo room, same angle, standard photographs. This is a standard lateral nose photograph. and it's perfect. Her head is not tilted. This is actually really difficult to do. As somebody who's taken standard photographs, it's hard to take a direct lateral photograph without having the head tilted too much this way or tilted too much this way. These are spot on, and you can see exactly what he's capable of doing with the nose with these photographs. It's amazing. He did an amazing job. You should check out his Instagram. He is quite good, and his photos are amazing. Hopefully this video showed you a little bit about what photo trickery goes on Instagram, how you can spot it in the future, and how you'll know, hey, wait a second, that's not right. And hopefully the word gets out and people stop doing this kind of thing, and so consumers or people that are looking at photographs actually get an idea of what's real and what's not, what you could actually expect from these treatments. And it's a shame because after someone who does these treatments frequently, I know they work, I know what they're capable of. I just don't know why photographs, I just don't know why they can't let the photos speak for themselves. Anyway, this is Dr. Tom. Thank you for watching. If you enjoyed it, please give a like and subscribe. If you want to, I've got tons more videos for you to watch. Follow me on Instagram. That's where all of my latest stuff will be, my before and afters that have good photos. And all of the content. I interact with people daily. I'm a pretty personable guy. I'm easy to talk to, and I make myself readily available to my patients. So if you want to reach out to me, there's a number of ways to do it. Call our office. I'll be happy to talk to you, even if I've never met you before. If I'm here and I'm not in surgery, done. Also, you can reach out to me on Instagram, DM me. I'm the only one that uses my Instagram, so I'll reply to you. You can reach out to me on Reddit. I'm Dr. Tom PS. You can send me a comment on YouTube. I'll reply to you there. I am readily accessible to answer patients' questions, and I try to be as personable as possible. Anyway, I'll see you guys next week.